Hello everyone, my name is Francis Chikaonda and welcome to Healthcare Eco Series. In this video, we are going to discuss transducer movements and manipulation. In order to obtain optimal ultrasound image, proper handling and movement of ultrasound transducer is very essential. There are traditionally 4 basic movements that are performed when scanning with ultrasound, and these are sliding, rocking, tilting, and rotating. There is also another technique that could be considered as 5th cardinal movement, and this is compression. So let us start with sliding. Sliding involves moving the entire transducer in a specific direction. So let's suppose this is our patient and this is our transducer. So when sliding, you move the transducer in any direction. Okay, so we are moving the transducer, the entire transducer, in a specific direction. So this helps us to find the best echo window. So if you want to find the best echo window, try to slide the transducer. Secondly, we have tilting, also known as fanning. So tilting involves moving the transducer from side to side along the short axis of the transducer. So this is the short axis of the transducer. So when sliding, you move it from side to side. So you can move it to the left, then to the right, or any direction that you want, but move it in this short axis. Tilting can help us to visualize multiple cross-sectional images of the structure of interest. So when you are tilting, it's like you are trying to slice the structure of interest. Thirdly, we have rocking or angling. Rocking involves moving the transducer either towards or away from the transducer indicator along the long axis. So this is the marker of the transducer, and when you are rocking the transducer or angling, you move it towards this marker or away from this marker, but along the long axis of the transducer. So this is the short axis, and this one is the long axis. This is short axis, and this one is long axis. So when rocking, you move it towards the marker or away from the marker. This movement can help us to center the area of interest. While tilting, we use it to move from one structure to the other, or it's like we are trying to slice the structure uh, into multiple images. Whilst rocking, you focus on the area of interest or the structure of interest. You don't move from one structure to the other. So when you are doing this movement, you don't move from one structure to the other. But what you are trying to do is just to focus on the area of interest. This movement is also called in-plane motion because the image is kept in plane throughout the manipulation. The fourth movement is rotating. Rotating involves turning the transducer in a clockwise or anti-clockwise direction along its central axis. So rotation, we try to move the transducer in a clockwise or anti-clockwise. Okay. So this is rotation. We are moving the transducer along its central axis, clockwise or counterclockwise. This movement is commonly used to switch between the long and short axis of a specific structure. So whenever you are scanning and you want to move from parasternal long axis to short axis, the movement that you do is rotation. I hope in the next video we'll discuss echo windows. So maybe you understand what I mean. I say long axis and short axis. Lastly, let us discuss compression. Compression involves putting down pressure on the transducer to evaluate the compressibility of a structure or organ of interest. Compression is commonly used when evaluating deep vein thrombosis (DVT). Compression can also be used to differentiate between an artery and a vein. So usually a vein is compressible, whilst an artery is non-compressible. Compression can also be used to evaluate appendicitis. So appendicitis is non-compressible. When the appendix is inflamed, it becomes non-compressible. In echo, compression is used to improve image quality. So sometimes when you are doing echo, the image sometimes maybe it becomes very difficult to visualize the heart. So apart from other things that you can do to improve the quality of the image, you can do compression. So I hope you have learned something, and when doing echo, you will practice these 5 movements that we have discussed: sliding, tilting, angling, rotating, and compression. Thank you very much for watching this video, and please remember to subscribe to my YouTube channel